Yeah. Okay. So in the process of which the nurse have been engaged into these responsibilities, we need to have the necessary skills, knowledge, and attitude, because mainly our core responsibility, as what I have mentioned, is patient safety. As we start with this discussion, we always start with a prayer for us to be enlightened accordingly. Let us claim it that even you are on your second year level, you must claim that you will be a registered nurse someday. This is the prayer that we're using for those who are taking the nurse licensure examination. So let us together and pray. Our Almighty Creator, we praise and glorify your name. We humbly submit ourselves on your vital intention to claim the Central Lino RN. Help us attain the optimum health at all times, with perseverance in leading to our RN goals. Nurture us with your spirit to keep our open mind to absorb and retain the lecture and skills concepts according to the nurse licensure examination framework. Let us decide to complete every examination according to your will with prudence and integrity. We appreciate you on our existence to contribute in Central Lino 100% through teamwork. As we leave ourselves to you on our journey with the core objectives of the MCU College of Nursing. Amen. Let the N21 be embraced with your spirit for them to sustain the stamina, the health, and for them to absorb what they will expect to learn in our session for this evening. Amen. Okay. It is very important for all of us to know what could be the direction of our discussion for tonight. We have set the learning outcomes or objectives for us to be aware on what to expect at the end of our discussion. The learning outcomes is at the end of the topic, given relevant actual or simulated situation conditions, the students will be able to, number one, explain the meaning of pharmacotherapeutics, pharmacokinetics, and pharmacodynamics. What are the common terms that had been integrated in these three terms? It's pharmaco, pharmaco, and pharmaco. When you heard about pharmaco, we're talking about drugs, we're talking about medications. And if we talk about number one, pharmacotherapeutic, if you've heard about in the commercials that there are supplements that may have a praise at the end of the commercial of no approved therapeutic claims. If we define therapeutic in pharmacology, we're considering the indication. What do we mean by indication? The drug is for the treatment of what? Okay? So that's why if there is no approved therapeutic claims, it means that the drug that had been advertised cannot be used for treatment of any disease or disorder. That is what we meant on that. If we are considering pharmacotherapeutics, we are studying on the first, the indication of the drug. Second, if we are considering pharmacotherapeutics, we are considering the desired effect of the drug. And the third, if we are considering pharmacotherapeutics, it is on the process that it already achieved the effect of the drug. So, if, for example, in pharmacotherapeutics, we have paracetamol. We are definitely aware paracetamol as over-the-counter drug. So, paracetamol is a drug indicated for fever. So, you are aware that the therapeutic effect of paracetamol is for fever. Paracetamol is also being used for pain. So that's why if we will talk about pharmacotherapeutics of paracetamol, its indication is for fever and for pain. Carbocysteine. These are the drugs that are familiar to all of you. Carbocysteine is considered as classified rather as mucolytic. Every time that you will encounter a drug that ends in lytic, anxiolytic, thrombolytic, mucolytic. Pag nakakadinig kayo sa classification ng drug ng lytic, it means that it is inhibiting or preventing. Kaya, if you encounter carbocysteine, carbocysteine is a drug intended for cough. specifically for productive CAP. If there is productive CAP, there is production of secretions. So what is now the pharmacotherapeutic or indication of the drug? The indication of carbocysteine as mucolytic, lytic, it prevents muco, meaning mucus secretion. So, ibig sabihin, the mechanism of action or rather the action or the desired effect of the drug is to prevent mucus production or mucus secretion or production of mucus secretions. Because we all know that mucus secretions may cause the possibility of obstruction of airway passages. Another, mucus secretions may cause also production, increased production that may lead to infection. Third, mucus secretion may cause also aspiration to the lower respiratory tract and may lead to the possibility of obstruction of airway passages. So that's why if there will be an uncontrolled production of mucus secretions, the normal mechanism or compensatory mechanism of the body is to do coughing. Coughing is considered as a reflex that will clear the airway passages. But there are some situations that you are experiencing productive cough and it is not effective for you to clear your airway via coughing. So you may need the carbocysteine to prevent the continuous production of mucus secretion. So carbocysteine. So every time that you will purchase a drug with a box, please try to retrieve the paper inside. The paper inside is the information, indicates the information that you may need for the drug. It's what we call drug literature. So that's why, if you may know there, indication and contraindication. So what's the difference between indication and contraindication? Indication means it's the purpose of the drug. The drug is for what specific disease? The drug is for the treatment of a certain disease. If we say contraindication, it's the opposite. The drug must not be given to cases or diseases as indicated because probably it may cause harm to the client. That's contraindication. So in the pharmacotherapeutics, it will give us the idea on how we will take into consideration also drug interactions. What do we mean by that? Class, I know for a fact, this is a reality. This is probably a lived experience among you that if you don't like the taste of the drug, there are situations that you mix it with a drink, milk, drink it with soda, drink it with fruit juices for you not to taste the drug. But there is a disadvantage on that. When a drug is being mixed with milk, moreover with antibiotic, the effect of that is it will decrease absorption. That's a problem every time that you will mix a drug with milk. Another, when you mix a drug or you take a drug with high acidic fruit juices, what do you mean by high acidic fruit juices? For example, concentrated orange juice, not the powdered juice, the concentrated, the naturally extracted fruit juice such as the orange, so highly acidic siya. Remember class, when you take an oral medication, the drug will primarily proceed to the stomach. The stomach has hydrochloric acid. Can you imagine an acid, then a drink that is also high in acid? There will be a problem with the breakdown of the drug. There could be a possibility that it will have premature breakdown of the drug, and there will be less concentration of the drug that will be absorbed. It may not reach the 100% desired effect of the drug. That's the problem. So those are the concerns that we will study about drugs. That's why there are some drugs that may not be mixed with other drugs because it will counteract each other. So those are pharmacotherapeutics. Let's proceed with pharmacokinetics. In pharmacokinetics, obviously, pharmaco is drug. Kinetics, we are talking about movement. Okay, In pharmacotherapeutics, it's maximum. In pharmacokinetics, we're talking about movement. Okay. In the movement of drug, at the time that you have an intake of drug, for example, via per orem or per orem, once it enters your mouth, it already start the process of ADME. Ano yan, sir, yung ADME? Letter A, it will start absorption. Letter D, distribution. Letter M, metabolism. And letter E, excretion. So in this ADME, in pharmacokinetics, since we're talking about movement, I will just have a situation for you to analyze. Which of the two administration site will have a faster effect of drug? Again, my question is that of which of the two administration site will have a faster effect of drug? Letter A, is it oral? Or letter B, intravenous? You may type it in the chat box if your answer is A or B. My question again, which of the following administration site will consider faster effect of the drug? Letter A, oral. Letter B, intravenous. So let's have our responses. We are 29 on board, and I may expect 28 responses in this Zoom room. So we have now attained 18 responses. So let's see, 19 responses. So probably we may need 8 more. Ayan, so 2. We may need 5 or 6 more. 6 more. Wake up for those who are not responding. This could be an interactive discussion and we are in the learning session. So we may need 4 more. Where are the others? Wake up. Your neurotransmitters are not working. If your neurotransmitters are not working, your brain may not function well, and it may lack oxygenation because your neurotransmitters are not working, then you are high risk of increased intracranial pressure and unconsciousness. We are now 30. Oh, it's again 29. So where are the other? Where are the other 2? Okay, the other 2. So I'll check your responses. Most of your responses are consistent. Okay, very good. With our 26 responses, all of you answered letter B. And I will reveal it. You have correct answer. Sir, please explain, why is it that the effect of the drug is faster in intravenous rather than in oral medication? This is now the principle. When the drug already reaches the plasma, plasma is part of the blood. Every time that the drug reaches the plasma, that is what we call peak concentration level. It means that the drug will start its onset, will begin its therapeutic effect. So, when you will take it orally, it will pass through the mouth, goes to the upper GI, goes to the stomach, goes to the hydrochloric acid synthesis, it will break down, goes to the gut, absorbed by the intestinal tract, it will be metabolized by the liver until it will be absorbed in the circulation and will proceed to the plasma. Can you imagine the pace or the paces that the drug follows through from the oral before it reaches the plasma? Compared to intravenous, when the drug enters within the blood vessel and the blood is already in the blood vessel, directly the plasma, or rather the drug, already reached the plasma because it's already intravenous. So that's why the shorter period of time, the peak itself, that it reached already the plasma, the short period of time that it reached its therapeutic or beginning or onset of its therapeutic effect. That's why every time that we encounter emergency cases, it's always intravenous or inhalation because it will facilitate that the drug will reach immediately in the plasma and will conclude the effect of the drug. So these are pharmacokinetics. How about pharmacodynamics? When we talk about pharmacodynamics, we are talking about how the drug will have the biochemical and physical changes. Are you aware of what is side effect and adverse effect? Almost all of us have received the vaccines. And every time that you receive vaccine, at the end of the vaccination, you will be asked, did you feel anything unusual? The one that we're referring to, the unusual symptom or manifestation, is referring to adverse reaction. That is the unusual, meaning the unexpected reaction of the drug. If, for example, you have received the vaccine and at the end, few minutes after taking the vaccine, after receiving the vaccine, then you experience difficulty of breathing. This is very unusual for someone who have received a vaccine. So that is considered as adverse reaction. It is not the expected reaction, the biochemical and physical response of the body. Now, what is side effect? The side effect is the one that is considered as the expected physiologic effect of the drug. For example, the patient will be receiving an antihypertensive drug. One of the side effects of antihypertensive drugs is headache. When the person experiences headache, it is the normal reaction of the drug, and the nurse responsibility is to explain to the client that it's part of the reaction of the drug. It has a certain time that we can consider because it is only temporary. But if the headache is prolonged within 1 hour or 2 hours, it's not anymore normal. And that leads to adverse reactions. Kaya it is very important for us to report adverse reactions. Why? Because adverse reaction may lead to severe adverse reactions. And what is that severe adverse reaction? Toxic effect. Pag severe pong adverse reaction, kasi it's very alarming yan for nurses, you need to take into consideration the thorough monitoring of the patient. Because anytime the patient will experience risk for complications or possibly may lead to respiratory dysfunction or cardiac arrest for worst case scenario. On the perspective that the patient is encountering adverse reactions, then the nurse must have the clinical decision making to prevent it to toxic effect. Class, once it reached the toxic effect, which is I think the number 2 learning outcomes, once it reached the toxic effect, from the term itself, toxic, parang relationship. Di ba pag relationship is toxic, it's unhealthy. Okay? And possibly if it will continue, it may not prosper. So that's why it must be prevented. So maghiwalay. So just the same as for drugs. If it may lead to toxic effect, it must be prevented. Why? Because if the drug will reach its toxic effect, it will be circulated all over the body. And what is very crucial, if the toxins created by the drug will reach the brain. And that will cause the possibility of dysfunction to our cerebral system. So pag nag-dysfunction ng cerebral system natin, what will happen? It will affect basically the function of the major organs. So that's why kung may toxic, there must be a drug to counteract toxic effect. What do you think is that? What are the drugs that will counteract toxic effect? It starts with letter A. You may type in our chat box for those who may know what are those drugs that will counteract toxic effect. It starts with letter A. I have received 1 response. Okay. Okay. So, continue. Yan. So, we have two responses here and your answers are correct. Antidote. Kaya if your relationship is already toxic, find an antidote for it. If the antidote for you is to separate, separate. Because it may not be healthy. Just the same for drugs or medications that reach its toxic effect. Kasi class, once the drug reaches its toxic effect, it's already life-threatening. It's already dangerous. And this is the severe type of adverse reactions. Kaya that's why we will not anymore wait for a longer period of time. Kasi if we will wait for longer period of time, the risk of or chances that it will lead to complications or possibly death. Okay? So antidote is the answer. Your answers are correct. It's coming from Miss Buenaventura and Miss Centino. Thank you so much for your response. You are absolutely correct. So, syempre, ang drugs po, each one of us may have only therapeutic level of drugs. A typical example, when a person is taking a digoxin, digoxin is an antihypertensive drug. At ang therapeutic level lang niya, yung normal level of digoxin sa blood, ay 2 nanograms per ml. Pag nag-exceed na yan sa 2 nanograms per ml sa result, kasi the nurse notice and observe adverse reactions, signs of adverse reactions, the patient will directly be subject for diagnostic examination such as to test for serum toxic level. Pag ang level ng digoxin ay 2 nanogram per ml below, it's normal. But if it will reach 2.1, 2.2, 2.5, 3, 4, 5, 6, that's an indication that from the result itself, it is confirmed that it's already toxic effect. Kaya you can expect for those who may have overdose. For those who may have overdose, expect toxic effect kasi the dose itself is more than the prescribed. The chemical properties that is supposedly managed by the body can only tolerate, it exceeded to that chemical properties that can damage the our major organs. My next question is that of, in toxic effect, there are 2 major organs which will definitely be affected. Please type in the chat box, what are the 2 major organs that may lead to its damage whenever there are problems with overdosage or there will be drug abuse? Again, what are the 2 organs that are significantly will damage if ever it may lead to toxic effect of drugs? So we have 5 responses. So, okay. Okay, so it seems you are connected. Aha, good, good. Good. I'm seeing correct responses. Ovary and fallopian tube. No answers in that. Just kidding. Okay. Okay. So it seems that your answers are correct. Almost everyone responded correctly with answers. It's always the liver and the kidney that is affected. Remember, class, the liver is the one that will have the function of detoxification. From the cigarette smoke that you take in your body, the liver is the one that will release an enzyme so that it will not reach yung toxic effect of nicotine sa body. Alcohol, for those who are drinking, the liver is the one that basically releases an enzyme to prevent toxic effect of alcohol in the body. And for drugs, we have a separate enzyme that is being released by the liver to prevent toxic effect of the drug. So can you imagine if you will have three processes in your body? You smoke, you take alcohol, and you take drugs. Can you imagine how the liver is forcefully working for you? So don't be engaged in those lifestyle that will kill, that will damage rather your liver. And since the liver is the one that detoxifies and prevent toxic effect, the coordination of impulses is with the kidney. The kidneys will be the one that will balance to remove all these toxins outside the body. It is via urine. And there are some instances that the liver will facilitate it in the hepatobiliary and may pass through the excretion via the feces or stool. So class, can you imagine, for example why in the alcohol? Okay, class, remember, I know you are using this term. Pare, pag may tama ka na ng alcohol, tama na. Okay, why you're saying that? Because the tama itself of the alcohol is an indication of high level of alcohol in the blood. Eh sir, you have mentioned that the liver is the one that detoxifies alcohol. Pero pag nag-drink ka na ng 1, 2, 3 bottles, why nagkakaroon ng changes sa what? Sa state of your alertness? Why nahihilo ka? Why you experience headache? Why you experience drowsiness? Because class, the effect of alcohol to liver cells, it slows electrical impulses of hepatocytes or liver cells. If you continue to drink alcohol, initially, di ba? Initially, when you take alcohol, your kidneys are very active to remove the excess alcohol through urination. Very frequent ang urination ninyo on the first bottles of beer or any alcoholic beverages. But as you continue drinking the alcohol, nagiging less frequent na ang urination nyo. Because that's the time. The liver is also having a delay in the metabolism. So what happens? What happens is that of the liver, since it caused the delay of detoxification, it increases the alcohol level in your blood. And do you know that? That the alcohol has a tendency to cause constriction of blood vessels. So can you imagine the alcohol that is circulating to your body and when it reaches to the brain? When it reaches to the brain, it will cause constriction of blood vessels. It will cause constriction to the blood vessels. Do you think it will allow blood flow? No, 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 no. It will limit definitely the blood flow. If it will limit the blood flow, what happens next? It will not deliver the sufficient oxygen for you to sustain your alertness. So what happens next? So since the alcohol itself is continuously increasing its level in the blood, it continues to constrict the blood vessel in the brain. So it will affect now your alertness. So that's why you are now experiencing drowsiness. That's an indication that your liver and kidney is forcefully working. Okay, that's why if you experience drowsiness when you are drinking alcohol, it's an indication that you need to rest, that you need to sleep, because your brain is having a hard time to sustain circulation. Kaya there are some instances that when you engage yourself into the alcohol drinking and you still continue, pare, kaya ko pa itong minom. Oh, diba? Lakas. So even though you are having the feeling of drowsiness and you continue drinking, what happens is that of when you sleep and kinabukasan, your brain is continuously compensating to dilate the blood vessels to sustain the circulation. And can you imagine that even though if you are sleeping, your brain is keeping on its function to survive its circulation. Kaya pag gising nyo sa umaga, anong nararamdaman niyo? Letter H, hangover. That's an indication that you have too much alcohol level in your blood. And that is already toxic effect. Remember that. Pag may hangover kayo, that is significantly toxic effect. It so happened that with your young age, your metabolic activity is very aggressive to prevent toxic effect. But in the increasing age, you could be high risk of liver damage and kidney failure as well. So take care of your health. Di po ako galit. I'm just reminding everyone. Okay? Next, when we talk about the nursing process, it will always be part of our responsibilities when we are getting towards administration of drug. And on this perspective, vital signs is very important when administering the drug. A typical example. So obviously, if you will administer an antihypertensive drug, you need to check the blood pressure. Okay? One drug example, I just want to set an example. Drug ending in olol. If you will check a drug ending in olol in the generic, example, metropolol, propanolol, atenolol. All drugs ending in olol are classified as beta blockers. Beta are receptors. So ano po ang action ng beta receptors? Ang beta receptors po ay nag-a-act when stimulated sa heart to have contraction. The more that you stimulate the beta receptor, the more the heart will contract. Can you imagine if you have known an individual who have goiter? Goiter is hyperthyroidism. If there will be an increase in the hormone production, any increase in the hormone production will lead to what? Increased metabolic activity. Pag increase ang metabolic activity, increase din ang impulse transmission. That's beta 1. Pag increase ang beta 1 transmission or impulse, your heart will pump vigorously. And what do you call the medical term that even though you will not auscultate, but you will feel already that your heart is vigorously pumping? It starts with letter P. Type it in the chat box if you know what is that sign. When your heart is vigorously pumping or contracting, you will feel it. And that's an indication of forceful contraction of the heart. Okay, correct. You tend to experience palpitations or you will palpitate. And that's an indication, class, that it's not anymore in the balance to have the systole and the diastole. It's very risky because it will lead to decreased cardiac output. Ang olol po ay tinatawag nating beta blocker. So pag binlock mo yung beta 1, pag binlock mo yung beta 1, it means, okay, block the beta 1, your heart now will go back to its normal function. Okay? Beta blocker eh. Binlock mo yung beta 1. Eh pag in-stimulate mo sa beta 1, okay, beta 1 stimulate. Okay, magko-contract yan na magko-contract. Parang simple. Ding ang bato, magko-contract yan. Kasi the adrenaline and the beta 1 will definitely stimulate the sympathetic response of the heart. Eh sabi natin, pag nagpa-palpitate, it's forceful, very forceful, or it will increase the workload of the heart. Siyempre, mag-i-increase din yung oxygen demand. So, kailangan po siyang slow down. It will block the beta 1. That's beta blocker. Question. Pag binlock mo yung beta 1, mag-i-slow down yung heart rate. Okay? Mag-i-slow down yung heart rate. Here comes the point of nursing process. Why do we need to consider nursing process? If, for example, the cardiac rate of patient is 55. Is that normal? I know you will answer, no, sir, because the normal cardiac rate or heart rate is 60 to 100. So meaning the patient is having bradycardia. Can you imagine that once the patient is having 55 or bradycardia, then you will give pa a beta blocker? It will further slow the cardiac rate. And if it slows the cardiac rate, it will drop the blood pressure. The patient will experience cardiac arrest. So what's the importance of nursing process? The vital sign itself will be your key reference for you to withhold the drug. And the nurse can withhold the drug because you have this principle and reference that it will risk the patient on this situation. So that's the essence of having the nursing process at all. Next is, it is very important for us also to discuss safety guidelines for drug administration. We have rights of medication, and these rights of medication will definitely guide us on how we will perceive our responsibilities as our advocacy for patient safety. And we will discuss that soon. I know that numbers are very important in drugs and pharmacology. Any number or dosage that you will compute matters because it may lead to a possible overdosage or underdosage. Both may cause harm to the client. Overdosage, it may cause toxic effect to the patient. Under dosage, the drug will not have an effect to the patient. There are some situations like you do self-medication. Don't deny it, huh? There are some individuals who are having self-medication on antibiotics. Sooner or later, if you consistently having risk of self-medication of antibiotics, you will experience antimicrobial resistance or drug resistance. Don't ever engage yourselves in self-medication such as antibiotic, because sooner or later, those antibiotic that you are taking will not anymore have an effect to your body when it is needed, or you are diagnosed that will need antibiotic. So that is merely drug. What you call this? A problem with drug resistance. Iba naman yung drug dependence. For drug dependence naman, the term itself depend. There are individuals who have been satisfied in taking drugs. Why? Kasi if the person takes a drug and it satisfies yung kanyang comfort or yung discomfort to comfort, from pain to painless, then it will be in your mindset that the one that can only resolve my problem with pain is this drug. So you will keep on depending on that drug. So that's drug dependence. Ngayon, if you will not feel any pain but you're still taking the drug, that's a problem. Ang problem na doon, drug abuse. You're taking the drug and you are, even though it's not indicated to take the drug. Moreover, if it causes the problem of taking the drug and you are not feeling the pain of the purpose of taking it, and it already caused a change in your behavior, that's already drug addiction. So those phases of drug action in our body matters. It will be our responsibility. I will now have an interactive session to all of you. Please open any of your gadgets that you have and join slido.com with the code 2224289. After the overview of our learning outcomes, what popped in your mind? What best define now pharmacology in one word? You may now enter your responses in our slido.com. I will wait. So it's the code that had been encoded. Okay. So what best define pharmacology now? What popped in your mind when we talk about pharmacology? So these are exploratory questions. It's all about drug. Okay. How about the others? Medication. Correct. Drugs. Measures. Measures because we need to compute for the dose. We need to calculate the dosage. So parenteral, okay, because we have the routes of administration, correct drug administration, correct, because it's on the safety guidelines. Treatment, because treatment had been associated with therapeutic effect of drugs. Routes, because it is dependent and associated with the effect of drug, which we had set an example if the drug is taken via oral and via intravenous. So we have analyzed those. Toxic effect, because the toxic effect is a serious adverse reaction of serious drug adverse reaction. And sooner, pag sinabi nating toxic effect, these are already life-threatening and dangerous. Correct. Toxicology, the study of the toxic effect of the drug. Do you know that, just continue your responses. Do you know that the study of adverse reactions is pharmacovigilance? From the term itself, vigilance, you will monitor harmful effect of drugs. That is pharmacovigilance. So when you are engaged into the study of toxic effects, you are saving lives because it may not lead to complications and may prevent death as well. Just recently, I was invited with the East Avenue Medical Center meron pala tayong nurse toxicologist. If you're interested to study about emergency care management on poisoning and emergency care management on adverse reactions and toxic effect of drugs, then this specialization could be in your hands. Nurse toxicologist. So can you imagine that? If you're a nurse toxicologist, you can now balance and save lives. So if we're talking about the study of drug, correct? The pharmacology, we always associate this with science. Okay, because we study about the properties, we study about the action of the drug, we study about the process on how it will be absorbed and excreted. You have indicated here enteral and parenteral. So these are the routes of administration. Preparation is very important as a term associated with pharmacology because we are aware that when you are going to, when you are aware of the routes of administration, you know how to prepare the drug. We have also narcotic. So narcotics are one classification of the drug, which we will discuss soon. Diagnostic, this could be your reference in the nursing process and administering the drug. If there are deviations in the results of the diagnostic exams, then you may have the clinical decision to withhold the drug. We may have the dosage because this is basically important to have the appropriate drug computation for the appropriate age. Remember, class, every time that you compute for drug dosage, you must take the weight of the client, lalo na when the patient is subject for induction of anesthesia. Okay? So with your responses, I know that you have been enlightened with these terms on how pharmacology works as part of our responsibilities. And it was defined accordingly. Let's proceed with the next slide. And it's defined accordingly as science. Why it was defined as science? Because it merely consider on how we will engage into the study of the preparation and properties or use of the drug. Because when we talk about the preparation, properties, and uses, this is on how you will help the patient be educated and promote independence to know the importance of taking the drug. When it comes to the uses, you must know the indication and contraindication. When is the time that the drug will be subject for the treatment of those diseases, and when is the time that the drug is contraindicated and may not be taken by the individuals with the identified cases or diagnosis. Side effect and adverse effect. When is the time that you will explain to your client that is the normal physiologic response of the drug? Adverse reaction, these are the unexpected reaction at the time that will alarm the nurse so that to prevent any complications. So the action itself will merely consider in the hands of nurses on how we will promote patient safety. We must also take into consideration to know the origin of the drug because drugs can be manufactured through plants, animals, or tissues. So in this consideration class, this will entail the what we call study of origin of drugs. And that is what we call pharmacognosy. The pharmacognosy is the study of the origin of the drug. A while ago, we have defined pharmacovigilance as the study of adverse reactions. Since this is considered as the science of drugs, we've considered also a systematized body of knowledge on how we know the effect of drugs in the body through ADME, absorption, distribution, metabolism, and excretion. We've already defined accordingly the division of pharmacology. Pharmacokinetics, we have mentioned that it is related to movement. Pharmacokinetics, or rather pharmacodynamics, is referring to mechanism. So we have mentioned about in the movement at the time that you have the intake of the drug from the ADME. For the pharmacodynamics, this is the mechanism, letter M. It is on how the drug have its change and effect, biochemical and physical changes. That's why we can identify the difference between side effect and adverse reactions. Pharmacogenomics is referring to the effect of drug to individuals. If, for example, you have history of asthma, if you have history of asthma, you are more prone with hypersensitivity reactions. What is hypersensitivity reactions? Allergic reactions. So each one, not all of us may have asthma, not all of us may have autoimmune disease, but it is very important for the history and the familial history of the client that if you're aware that the client is having a history of asthma, this may have a concern with allergic reaction. And that may lead to a possible allergic reaction of drugs. Hormones. Male and female may have similar hormones. But the difference is that of male may have higher level of testosterone compared to females. Females may have higher female hormones such as progesterone. So can you imagine that if a male will take progesterone and estrogen, it will project features of a female such as enlargement of the breast. For the female who is taking a supplement of testosterone, he may have the look of a male who may increase hair growth. That is the study of pharmacogenomics. Each one of us may have different reactions on drugs, gender, inherited diseases, or disorders. And number 4, we have pharmacotherapeutic. This is the time that we have considered that it has reached the desired effect and maximum effect. Let us now proceed. This is now another interactive discussion. After the discussion, the brief discussion about pharmacokinetics, pharmacodynamics, pharmacogenomics, and pharmacotherapeutics, I am encouraging everyone to post the responses in the chat box. Let's start with the first question. The nurse who is caring for a client explains the movement of drugs into, through, and out of the body. Is this referring to pharmacokinetics, pharmacodynamics, pharmacognosy, or pharmacotherapeutics? Post your answers in the chat box. The nurse who is caring for a client explains the movement of drugs into, through, and out of the body. A, B, C, or D, we have already 23 responses on board. Hoping for some, we are now 29, and hoping and expect that you will break the record of the other section of maximum responses. They have always reached the maximum responses. So I'm expecting the group will have 28 responses. So we have 24. So we are calling for the attention of the other 4. If you can add to the 24 that we have of the supposedly expected 28 responses. 5, 4, 3. Oh, okay, 25. We lack 3. 3, 2, 1. So I'll just check your responses, ha? Okay. It seems everyone is listening in our discussion. All of your answers are correct. And we are having pharmacokinetics. Because again, in pharmacodynamics, we are referring to the biochemical changes and physical changes of drug. Pharmacognosy is referring to the study of origin of the drug, and pharmacotherapeutics is referring to the maximum effect of the drug, the side effect, treatment, indication of drugs. Let us now proceed to the next question. Be ready again. Pharmacokinetics can be simply described as the study of what does to to do to the drug, except if except is indicated in the question, you need to identify the incorrect statement. Letter A, the rate and extent to which drugs are absorbed into the body and distributed to the body tissues. Letter B, the rate and pathways by which drugs are eliminated from the body by metabolism and excretion. Letter C, the relationship between time and plasma on drug concentration. And letter D, come up, letter D, the drug produces biochemical and physiologic changes in the body. Which of the following statements are not connected to pharmacokinetics? Because we are looking for except. Please post your answers in the chat box. Okay, 3 responses. So we expect more. So actually, class, the questions that I retrieved here came from references of nurse licensure examination and NCLEX, an international examination. So I have 20, 21, 22. So more responses. More responses. So I expect 25 or more. 25 or more. So we have 24, 25, higher than that. So let's see if it will reach 28. So it seems nag-stick na lang tayo sa 25. So let us analyze. But first, I'll check your responses. Kasi I can retrieve your responses eh. Oh, it seems everyone is really listening in our synchronous session because all of your answers are correct. Why the answer is letter D? Because letter D is referring to pharmacodynamics. Letter A is referring to pharmacokinetics because of the term absorption and distributed. In letter B, it is related or connected to pharmacokinetics simply because it entails here the term eliminated through metabolism and excretion. It's ADME. Letter C, it is connected also in the pharmacokinetics because the absorption starts and its effect has been considered if the drug reached the plasma. So the answer is letter D. Next question. The nurse is aware that the maximum use of drugs to treat a specific disease or produce a desired effect is called as pharmacokinetics, pharmacodynamics, pharmacogenomics, or pharmacotherapeutics. Post your answers in the chat box. The nurse is aware that the maximum use of drugs to treat a specific disease or produce a desired effect is called as what? So I have 19 responses, 20 responses and more. So your neurotransmitters are really working because I have noticed and observed that answers are fast, fast pacing. So we lack, a while ago we have 25. So we're still lacking 1, but hoping it will change and increase to 28. So probably others are having problems with connectivity. So, okay, but anyway, since majority have responded, and I'll check now your responses. Okay, so it seems again, everyone is listening. So since the term in the question is maximum treatment, desired effect, then we refer to pharmacotherapeutics. Next question. The nurse noted a harmful, unintended reaction of the drug, which refers to desired effect, adverse effect, toxic effect, or side effect. The nurse noted a harmful, unintended reaction of the drug, which refers to A, B, C, or D. Post your answers in the chat box. Now na po. So 17 responses, 18, 19, 20, 21, 22. Next. Nababawasan po ang ating responses. 22, 23. More responses, please. 23. Kanina 20. Yan, 24. So baka can I appeal to have a higher response than 24 because it's consistently recorded to have 24. Mukhang dyan na lang tayo nag-e-end sa 24. So, ayan, 25. Very good. More. If it will reach 28, I will be very much happy. More. 26, go. I need 2 more. 2 more. Ayan, 27. Wow! Very good. Tan, 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 tan. You are a good singer. Okay, let's proceed. Okay. The nurse noted the harmful unintended reaction, and thank you very much for the maximum responses. Remember in the question, it's harmful. Who among you will have an answer of side effect and the side effect as harmful? Tingnan natin yung responses. Okay. Okay. Sige. So it seems majority of you have responded. And class, hindi po desired effect at hindi side effect. So it's either letter B or letter C. Okay? So, since it considered harmful pa lang, kasi pag higher level of harm, such as dangerous and life-threatening, iba na yung effect na yon. But for now, the answer is adverse effect. Okay? Next question. The nurse notifies the physician due to a serious adverse effect that occurs when plasma concentration of the drug reaches dangerous and life-threatening level. Meaning, dangerous and life-threatening level. Which of the following, which of the following we are referring to? Is it side effect? Is it adverse effect? Is it toxic effect? Or is it desired effect? So if it is already dangerous and life-threatening, I don't know if you will have answers of letter A and D. I think anyone will definitely agree with me not to have the letter A and letter A and letter D if it is already life-threatening. So you may have only letter B or letter C. So we have 24 responses. 24 responses, and it seems upon checking, okay, maximum responses. Very good again. I really admire and salute to have maximum responses now. Your answer is toxic effect because it's already dangerous and life-threatening. Okay? And another is a serious adverse effect. Next question. The nurse emphasized in her health teachings on the reduction of effectiveness of drug. Ay, hindi na nagte-take effect yung drug. In treating a disease or condition that refers to, is it drug tolerance? Is it drug resistance? Is it drug dependence? Or is it drug abuse? Which of the following considered po in the health teachings of a nurse referring to reduction of effectiveness of the medication in treating a disease? So I mentioned a while ago that you must not have self-medication. And because that may lead to this problem. So let's check your responses. We have 23 responses. Oh, I know, and it seems that everyone is really listening. Let's check. So thank you very much for responses, and we will reveal now. The answer is drug resistance. All of you are correct. Ten, 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 ten. Sound effect ka pa, sir. Pag if we say drug tolerance, this is the situation wherein the patient, for example, di ba, may mga individuals who cannot tolerate paracetamol for pain relief. Ay, mahina sa akin ang paracetamol. Pero ibuprofen sa akin, okay. So may mga ganong situations. Yun yung drug tolerance. Or it could be by dose. Ay, mahina sa akin ng 500 milligrams. 1 gram, dyan ako na ma-manage yung pain. Kasi yung pain tolerance ko, hindi kaya na 500 milligrams. So meaning, itataas yung dose, pero yun kasi yung risky. Pag tinaas mo yung dose, magde-depend ka na or magkakaroon ka na ng mindset na hindi nagde-take effect sa'yo ang 500 milligrams. So pwede kasi siyang maging dependent dun sa dose na yon and somehow ma-abuse. So next question. Actually, this is a question. The nurse assists the client after taking the medication on the expected physiologic response that is unrelated to the desired action of the drug. So what could be the key term or the key clue here? Expected physiologic response. Okay? So let's have choices. Is it referring to toxic effect? Is it referring to adverse effect? Is it referring to side effect? Or is it referring to desired effect? Which of the following is expected physiologic response of the drug? Cast your answers in the chat box. It seems everyone are putting their answers because they are confident. Continue to post your answers. Now everyone is talking. Everyone have unified responses. Since this is an expected physiologic response, the answer is, reveal the answer, sir. Side effect. Okay, we have the side effect of the drug. Next question. The next question is that of the nurse understands. This is now the challenge. When you take nurse licensure examination and the question is as long as this to one, the problem is that of it will really test your focus. Lalo na if the question is misleading and will confuse you. Example, the nurse understands that the ability when the client endure ordinarily injurious amounts of a drug or the lowering of the effect obtained from an established dose that requires raising the dose to possibly toxic level to maintain the same effect. I know you will have the same reaction. Ano daw? So, if you tend to encounter this type of question, very long, and at the same time, you can imagine and analyze what is being asked in the question. So, just take into the consideration yung the client may have injurious amount or higher amount or lowering its effect. Meaning, not all of us may have the same response to a drug. It could be a lower dose of a drug or probably a higher dose of a drug. So let's see if you can have those answers. Let's have choices. Is it drug reaction? Is it referring to drug dependence? Is it referring to drug effect? Or is it drug tolerance? This is on how the person perceived his or her perception to drug. And this may have different responses. If you can, pag ginamit ko kasi yung term, malalaman nyo na, if you can manage yung use of the drug on your discomfort or on your intention for the relief of discomfort. So let's check the answers if you are inclined with the correct answers. It seems all of you are aligned with the correct answer. So the answer is drug tolerance. The drug reaction in general is referring to either adverse reaction or side effect. The drug effect is referring to obviously efficacy or effectiveness. Let us proceed to the next question. Next question, the nurse observes the client on the physical and psychologic reliance. Remember, pag sinabi nating reliance, I rely on you. So try to have it in mind na. Psychologic reliance on chemical agent that could be high risk for what? That could be high risk for continued use, abuse, or addiction. Is it referring to therapeutic effect? Is it drug dependence, drug interaction, or desired effect? Which of the following is referring to the situations that the person or the individual is already on a physical and psychological reliance on the drug? Cast your answers. I'm seeing answers in the chat box. Continue to post your answers. Okay, so it seems everyone have posted their answers. Let us reveal the answer. The answer is referring to, obviously, if it is use, abuse, and addiction, it's not therapeutic and desired effect. Who among you will classify it as the desired and therapeutic effect if it's use, abuse, or addiction? So it's either drug dependence or drug interaction na lang yan. So what we have defined with drug interaction is if it will counteract the drug effect, di ba? If it is mixed with other drugs, if there will be a problem with absorption. So that's drug interaction. So obviously the answer is drug dependence. Okay? Next, we have to consider po that this self-assessment exercise will merely consider po our response pertaining to our assessment on how we will deal accordingly with our responsibility on the administration of drugs. Since we ended up with the self-assessment exercise, then we will proceed to the next part of our topic. But first, we will have our health break. Health break is very important to attend to your physiologic needs. Number two, it is very important for you to stretch your extremities for purposes of circulation. So you may hydrate yourselves and have your electrolytes to the optimum. So we will continue our discussion, our health break. Have your health break first. Okay, so let us continue our discussion. So since we have ended up the self-assessment exercise, I know that the self-assessment exercise in your central linda pizza are already open, but you can proceed naman later because that will be until 9 o'clock. Okay, so let us continue with our discussion. Our discussion now will proceed on the, I'm sorry, we are done with this. We will now have an introduction of what pharmacokinetics is through the audio-visual presentation.
Hi, this tutorial is the first in the pharmacokinetics series. So first of all, I should talk about what pharmacokinetics is. Within pharmacology, we often talk about two distinct, but unfortunately unintuitively named branches. These are pharmacokinetics and pharmacodynamics. Briefly, pharmacodynamics is the study of the effects of drugs on the body. That is, what does this drug do to the body? What receptors does it activate? And what other effects does it have? Alternatively, pharmacokinetics is the study of the effect the body has on drugs. In pharmacokinetics, we ask questions like, how does the drug get into the body and where does it go? What does the body do to the drug? And how does the body get rid of the drug? It is this branch of pharmacology that we will be looking at in this series. So let's begin with a pharmacokinetics acronym you'll find in every textbook of pharmacology. ADME. A-D-M-E. This stands for absorption, which is how the drug gets into the body. Distribution, which is where the drug goes to in the body. Metabolism, which is how the body chemically modifies the drug. And finally, excretion, which is how the body gets rid of the drug. These are four elements we need to consider when talking about the pharmacokinetics of a certain drug. The following tutorials will each talk about a certain aspect of pharmacokinetics. But for the remainder of this tutorial, we are going to discuss some of the more boring but incredibly important aspects of pharmacokinetics and pharmacology. So I'll begin by drawing a graph. And here on the y-axis, we have the concentration of drug within the body. And on the x-axis, we have time. So if we give a person a drug at time 0, then we will see the concentration of the drug go up, and then it will fall slowly as the drug is removed from the body. And that's what we see on this graph. So looking at this graph, we can see that in this section, the drug enters the body faster than it is being removed from it. Therefore, the concentration of the drug in the body increases. Then, after the peak of this graph, the drug is being removed from the body faster than it is entering. So the concentration of the drug in the body starts decreasing. This point at the top of the graph is important because it is the highest concentration of drug in the body. Therefore, we call this the maximum concentration, or Cmax. This is important because knowing the maximum concentration can help predict the therapeutic benefit and also the likelihood of side effects. The time at which the maximum concentration occurs is called Tmax. Now, a slightly more confusing concept is the half-life of a drug. The half-life.
Okay, so if you notice in this graph, the drug had been given, once it enters the body, it will proceed to the maximum concentration. It means that when the drug reaches the maximum concentration, it means the drug already reaches the plasma. Okay? Then if you notice and observe also that as the drug reaches the maximum concentration, from the peak concentration, there is a decrease in the concentration of the drug, because this means that the drug is starting to be excreted out of the body. So when the drug reaches the peak level, there is the maximum concentration of the drug and the maximum time that the drug reaches the peak concentration level. This is one of the examples that I told you before, that when the drug is given orally, it will still pass through the perspective that it will reach the point that it will consider yung part that the drug already reaches the plasma and having its effect. Pero it will have a long phase kasi it will pass through the stomach before it reach the intestinal tract and reach the plasma itself. The other one is when the drug already reaches through the intravenous and it's in the plasma, it will already reach its Cmax and Tmax. It was mentioned also yung concept of half-life. Yung half-life class is the 50% wherein the drug is decreasing its concentration. Class, the half of this drug, the half concentration and the half time here is the 50% when the drug already reaches to decrease its concentration from the peak concentration level, and it decreases the time. The half of the Tmax and the Cmax is considered also already the half-life. For example, the drug is being given for 8 hours. And within that 8 hours, if we divide it with the half, it's 4 p.m. Meaning, from 12 o'clock to 4 o'clock, the drug is already reaching its 50% half-life of the drug. And the other 50% are now being excreted or processed to be excreted out of the body. The next dose would be 8 o'clock. And it must be given on the right time. Once you will not give it on the right time, it will not reach the 100%. So that is the concept of the Cmax, the peak concentration level. It is the time wherein the drug already reaches its effect. And we have the half-life, which is the 50% that decreases already the concentration of the drug. So as we proceed with the pharmacokinetics, it considered the movement of drug across the membranes. And we have considered already the ADME. I will now present again to you another audiovisual presentation for you to appreciate of if a drug is given orally, intravenously, and by inhalation, why is it that the effect and the peak concentration level matters when it is given through this administration site? So let us proceed to another audiovisual presentation.
Hi, this tutorial is the second in the pharmacokinetics series. And in this video, we're going to have a look at absorption, or more specifically, routes of drug administration. If you haven't seen the previous tutorial, I highly recommend watching it before continuing with this video, as we will use terminology which was introduced and defined in that tutorial. So I'm going to begin by drawing a very simplified body plan. And this body plan follows the flow of blood from the digestive system to the arterial circulation. So let's see how this happens. So blood flows from the gut to the liver via the hepatic portal system. Blood then flows from the liver back through the venous circulation and into the right side of the heart. The blood then flows through the pulmonary arteries to the lungs. Then from the lungs back to the left side of the heart, then out into the aorta and into the arterial circulation. What we are going to do is place drugs into different parts of this system and measure their concentration in the arterial circulation over a period of time. So I'll draw a set of axes.
Okay. If you will go back to the foundation of anatomy and physiology, talking about circulation, di ba, when unoxygenated blood is carried through the vein, goes to the right side of the heart, oxygenated through the lungs, oxygenated blood goes to the left side of the heart, and proceed to the aorta as oxygenated blood to the systemic circulation. So once the drug reaches the systemic circulation, that is the point that we are saying that the drug already reaches the peak plasma concentration level. But sir, why is it involved the liver and the gut? If the drug is being administered via oral, it will pass through the gut, the intestinal tract, and every oral medications that you administer will always be metabolized by liver. And that is what we call first pass effect or first pass metabolism. So any oral drugs that passes through the stomach will always be detoxified by the liver through first pass effect. Now, question. Sir, if the drug now had been administered in the vein, will it consider pa ba ang first pass effect? The answer is no. Kasi if you will check yung direction niya, pag it was administered via the vein, it considers na yung proceed niya sa heart, sa lungs, sa heart, and systemic circulation. Hindi siya magre-retro. Hindi siya magre-reflux. Rather, hindi siya magre-retro direction. So it's unilateral. So lahat lang ng oral drugs na dadaan sa gut ay parating dadaan sa liver. But when the drug has been administered via vein, diretso na yan papunta dito. Sir, paano po if the drug has been given via inhalation? If the drug is given via inhalation, mas shorter na yung dadaanan niya. Left side of the heart and the systemic circulation. Kaya if you will notice and observe, the longer yung pace ng pag-flow sa phases ng drug to these organs, the longer ang effect ng drug. So can you imagine an oral drug? It will pass here and proceed to liver, the vein, the heart, the lungs, the left side of the heart, and systemic circulation. And if the drug passes through lungs, shorter yung pace. Kaya ano ngayon ang conclusion? Sir, alin po sa tatlo na na-mention ko ang mag-reach agad sa peak concentration level or sa plasma? Yung oral drug, yung intravenous drug, or drugs had been administered in the lungs? The answer is definitely the lungs, the one that had been inhalated, kasi mas shorter na yung pace para mag-reach siya dito sa systemic circulation. Unlike for the oral medication, it will pass through pa sa liver before it will reach the artery. So that mainly will discuss this graph. Ayan, puberty. Napipiyok na si Sir nyo. That will process indeed to this graph to best explain ano po ang mechanism ng peak concentration level for oral, for inhalation, and intravenous. Let us continue.
And on the y-axis, we have blood concentration of drug. And on the x-axis, we have time. We'll begin with the most common route of drug administration, which is orally. These drugs move through the digestive system and get absorbed by the gut. Then they move through this whole system. That is, the liver, the venous circulation, the heart, the lungs, back to the heart, and then to the arterial circulation. This takes quite some time. So what we see is a slow rise in the blood concentration and then a slow fall. Note that the Cmax is quite low and the Tmax is quite large. We'll now contrast that with intravenous administration. Assume that we give the same dose of the drug intravenously. And for those who have read ahead, this drug does not undergo first-pass metabolism. In intravenous or IV administration, The drug doesn't have quite such a long journey to reach the arterial circulation, as it only has to go to the heart, the lungs, back to the heart, and then to the arteries. This results in a quicker rise of drug concentration, which might look something like this on the graph. Note that the Cmax is larger and the Tmax is smaller, even though the dose was the same. This is because IV is a more direct route of administration than orally. Now contrast this with inhalation of a drug. Let's again assume that we have given the same dose of the drug as the last two examples, but this time we are giving it as an inhaled form. Many anesthetics are actually given this way. The drug now only has to go to the heart and then straight on to the arterial circulation. This means we will see the concentration of the drug shoot up very quickly. So note the much larger Cmax and the even smaller Tmax via this route of administration. Also, remember that in all these three examples, the dose of the drug was identical, only the route of administration changed.
Okay, if you notice, number 3 is inhalation, number 2 is intravenous, and 1 is via oral. If you notice, yung sa flow po ng sa oral medication, it took longer pa para mag-reach siya sa peak concentration level. Kasi mahaba yung pace niya before it will reach the systemic circulation. Unlike for the number 2, intravenous, which sabi it will not pass through the liver. So if you will notice, since papunta na siya, it's only on the 3 paces na lang before it ends up to the systemic circulation, mas mabilis mag-achieve yung concentration level or peak plasma ng gamot. And for inhalation, after the left side of the heart, it already proceed to the systemic. Kaya mas mabilis ngayon mag-achieve yung peak concentration ng drug, yung effect ng drug, and it will decrease soonest kasi nag-reach na sa peak concentration level at nag-achieve sa systemic circulation. So this is very basic when it comes to the route of administration. Kaya it's always a consideration po sa absorption na the drug from administration site, it will pass through the tissues, then proceed ang pinakalas for the absorption pag nag-proceed na siya sa blood specifically with the plasma. Now, there are factors that will really affect degree and rate of drug absorption. So administration route. So kanina, minention natin yung oral, yung intravenous, at saka inhalation. It matters, diba, yung time at saka yung effect. Letter B, patient's age and physical condition. If you will notice, those are involved organs are the GUT, the gut, the liver, the heart, the lungs, blood vessels. If the patient have these conditions that has been diagnosed with this person, pwedeng maka-affect yan sa absorption. Pwedeng pag may liver problem siya, the person is taking oral medication, it may delay absorption. Sa patient's age, moreover, elders po, hindi pa ako doon ha, elders have slow metabolic activity. Kaya sila yung mas prone po na mabagal ang effect ng drug. Kaya sila tinawag na vulnerable because they are high risk of adverse reactions. Letter C, lipid or water solubility of the drug. Ang mga water soluble drug such as tablet can easily be break down and be absorbed effectively. Unlike sa mga oil-based drug, nakakikita kayo ng capsule, di ba, para oil-based drug, yun yung mga alaksan FR, fish liver oil, ito yung mga lipid-soluble drug na matagal pa siyang ma-absorb because it's lipid-soluble. For letter D, potential interactions, this is what I have referred to you a while ago, that there are some drugs that may not be given with other drugs or with food or with milk because it counteracts its effect. Somehow, a review pertaining to enteral and parenteral routes. So I know you have been oriented on this. And let us have a review on the enteral roots. For enteral roots, just be guided lang. Yung naka-blue na mnemonic dyan, this will be your guide. Just a reminder din po that these learning materials had been uploaded already in your Central Lino Pit Stop. And all of the videos that you have watched were also uploaded in the Central Lino Pit Stop. Just proceed in the supplemental learning videos. To continue, for oral medications or administration rather, just remember 2 CASGIP. What do you mean, sir, by 2 CASGIP? 2 Cs. Oral route are common and convenient. AS, oral route absorbs slowly. Oral route will always or will expect gastric irritation. Kaya most of the drugs that are taken orally are with food kasi nga it may lead to gastric irritations. Moreover, ano ba yung mga gamot na naglilid talaga sa gastric irritation pag hindi kayo nag-take with food? Ibuprofen, Alaxan, expect nyo yan. Nako, high risk kayo for gastric irritation or ulceration. Steroids, those drugs ending in zone, yung mga dexamethasone, prednisone, yan, mga gastric irritants yan. Talagang sisikmurain kayo dyan. There are some situations during this time of pandemic, pag nagbibigay ng mga, what you call this, ng mga steroids, it's always kasama na niyan yung pag-stabilize ng acid level. And letter P, oral route will always consider po a typical route for pain. So ang oral natin, 2 CASGIP, common and convenient. AS is absorbed slowly. GI, it always causes gastric irritation, and a typical route for pain. Next, we have the what we call buccal. For buccal po, we are considering po SIGUP. What do you mean by SIGUP? The drug are administered for a while. Okay, SIGUP, it's administered between the cheeks and the gums at magpapacilitate po ito to have action pag mataas ang concentration or pH. Kaya usually the drug is given via buccal. Ito usually sa mga cancer drugs. For a while. So most of the cancer drugs kasi are gastric irritants. Kaya lalo na for pain relief, kaya ang mechanism po for management of pain for cancer patients, buccal siya. And fentanyl is one of the example. Next, we have sublingual. Sublingual, tandaan lang po ang carbs. T for under the tongue, AR, absorb rapidly. So this is opposite with absorb slowly sa oral. Ang absorb rapidly is sublingual kasi rich po itong ating dila ng blood vessel. Kaya anything that will cause sore or lesions, nagbi-bleed agad yan. So it is directly absorbed bloodstream. Kaya it starves. One of the example of drug that is given sublingually ay nitroglycerin. Ito po ay vasodilator. Vaso, blood vessel, dilator, open. So, these are for chest pain. Remember class, pag ang individual po ay nagche-chest pain, ang always indication niyan ay kulang sa oxygen ang heart muscle. It is brought about by constricted blood vessels or may bara sa blood vessels. So ang nitroglycerin po are given sublingually and it will manage immediate opening of the blood vessels of the heart. Other than if it is given intravenously. Pero the nitroglycerin is the one that has been used pagka may chest pain other than intravenous. Among the enteral routes, sublingual talaga ang nag-absorb rapidly compared to oral which absorbs slowly. Next, we have the rectal. Tatandaan lang po natin sa rectal ay rait. What does rait? What does rait means? Ang rait po, it means that it is inserted via rectum and absorbed in the intestinal tract. Ang example dito po ay yung mga suppository. Just like Dulcolax. Di ba may Dulcolax tablet at may Dulcolax suppository? Yung suppository, it is administered via rectal. At bakit magandang absorption via rectal? Kasi rich din sa blood vessel ang Ang intestinal tract. Kasi doon siya pwede rin mag-absorb. Other than that, meron din tayo mga paracetamol suppository. Yung paracetamol suppository po, class, there are some situations na ang mga pediatric clients nagko-convulsion sila eh. And that convulsion ay nagko-cause po na hindi ay contraindicated ng oral medication. And paracetamol suppository is given to manage febrile conditions. Let us now proceed with parenteral routes. Pag parenteral routes, tandaan po natin ang DOBS. But we will proceed, let's have a review. Ano yung sabi natin sa oral? 2 Cas-Gib. Ibig sabihin, convenient, common, absorb slowly, gastric irritation, and common for pain. 2 Cas-Gib. Next, we have the buccal. So sabi natin sa buccal, it's Sigup. The drug is being given between the cheek and the gums but may need optimal level of pH. Sublingual, TARBS. It is given under the tongue, absorbed rapidly in the bloodstream. And what is rectal? Rait. It is administered in the rectum and absorbed in the intestinal tract. Now we have DOBS. What do you mean by intravenous? Direct access to bloodstream. Diretso na siya. And most common drug dito ay mga intravenous fluids. Next, ano po ang intramuscular? Ang intramuscular naman po, ang tatandaan natin ay ML, not Mobile Legend. MLHSB3. It means M, muscle. LH, less hazardous. And we have stays in the blood longer, SB, stays longer sa blood. At 3 ay 3 ml. Class, pag nagbigay po ng gamot via intramuscular, longer po ang effect. Kasi it stays in the blood longer. Meaning, if the drug stays in the blood longer, mas mahaba ang effect niya. Never exceed 3 ml in giving intramuscular drug. Pag lumagpas sa 3 ml yan, it will damage the muscle. It will cause irritation. It will cause swelling, and soon it will cause tissue death. Now, it is not recommended for ventrogluteal and dorsogluteal. Bakit? Kasi these are the areas that has sciatic nerve and may cause paralysis. Okay? Next, a sample of drug is haloperidol. This is an antipsychotic drug. So sa ating mga may mental deviations. So pag may mga mental concerns or behaviors that may need to calm is the antipsychotic drug being given intramuscularly. Next, we have the subcutaneous. Sa subcutaneous, you will just have FTSM2. FT, ibig sabihin, fatty tissues ang subcutaneous. It is between SM, between skin and muscles, At ang maximum dose for the subcutaneous is only 2 ml. Minimum of 0.5 ml. Remember that, ha? Don't ever exceed 2 ml because it may cause the possibility of irritation and drug damage. Or rather, tissue damage. Gradual ang absorption pag subcutaneous. Kasi pag binigay mo yan sa intramuscular, stays longer. Example natin, insulin. Pag binigay mo yan sa intramuscular at longer yung effect niyan, magtutuloy-tuloy po yung pagbaba ng blood sugar. So pwedeng bumaba naman siya from normal range. Pag binigay mo naman siya intravenous, sudden drop ng blood sugar. Pwedeng mag-hypoglycemic shock. Kaya po kailangan subcutaneous kasi gradual lang absorption, minamanage niya to balance the appropriate level of blood sugar that is within normal range. So another example is heparin. This is anticoagulant. Pag sinabi natin coagulant, it will prevent clotting. Kasi class, pag may mga situations na nadamage ang blood vessel brought about by alcohol drinking, by smoking, yan yung mga nai-stroke at nag-heart attack. Pag ito po ay binigay ng intramuscular, magkukos ng bleeding. So dapat subcutaneous po. So this was the summary of our discussion for today. And the last slide for today of our discussion is related to this. Yung route for administration, if you will notice and observe, yung intravenous and intraosseous. Yung intraosseous, when the drug is being directly administered sa bone, nandun ng red blood cell production. 30 to 60 seconds yung time that it will reach its effect. Pag endotracheal is a tube that is been inserted directly to the trachea. Ito yung nakakonect sa sa ventilator. Pag ang drug ay being given by endotracheal and inhalation, 2 to 3 minutes po may effect na yan. Sublingual, 3 to 5 minutes. Intramuscular, 10 to 20 minutes. Subcutaneous, 15 to 30 minutes. Rectal, 5 to 30 minutes. Ingestion, 30 to 90 minutes. Can you imagine yung intravenous 30 to 60 seconds, tapos yung oral nyo 30 to 90 minutes, ibig sabihin 30 minutes to almost 1.5 hour pa yung effect. Kung emergency case yan at binigay nyo yung ingestion or oral, can you imagine it's 1.5 hour that it will have its effect? Baka hindi na ma-reach yung objective natin for the patient to be revived. Ang transdermal po ay topical. It will be applied to skin. So it will be variable. It will vary minutes to hours po. So this will give you the idea of why we discuss the enteral and parenteral and the connection of time and effect of the drug. So probably this will stop my topic for today. So I'll stop.